Hey, welcome to another episode of Your Faith and Health Community. I'm your host, Pastor Jackie Jackson, and I want to thank you for taking out time from your day to spend with us. Surely you could have done anything else with your time, but you're here, and I want to guarantee you, or at least I feel in my heart, as always, we're going to have some information that's very, very important to you. But before I jump on that, you know what I'm getting ready to do? I'm getting ready to talk about you getting enrolled in healthcare. If you have not yet enrolled in healthcare, I want to make sure you understand the importance. Yeah, you may have missed the deadline of January 29th or January 30th or 31st of this year, but if you have a pre-existing condition, maybe you just recently got married or divorced, had a baby, had two, recently was released from a penal institution, just moved into the state of Ohio, or you just changed jobs. That puts you in a life-changing event, which gives you the opportunity to enroll in healthcare even once the marketplace closes. Now, keep in mind, you only get 30 or 60 days from your life-changing event in order to enroll. But at the end of the day, it's better than spending that money on a fine. I always say, if you got money to throw away, just give me a call here at the station. I'll be glad to pick it up and put it to good use. So remember, just get enrolled. And if you don't do it for you, then do it for the loved ones in your life. And remember, Medicaid has no open enrollment. It's open all year round. It doesn't close. So if you are single, making $16,248 or less, then that makes you eligible for Medicaid. So there's no need for you not to have some form of health care insurance. All right, so listen, I'm very, very happy and excited to have my friend, she's like my sister. At one point when we were at Enroll America together, she was my work wife by the name of Marjorie Mosley, who is a navigator with Resolute Navigators out of Dayton, Ohio. And we also have with us Ryan Fay, who is also a navigator with Resolute out of Dayton, Ohio. And we're going to talk healthcare. We're going to talk about getting you enrolled. See, the way I opened up the show worked out perfect because it segued right into our guest. So I want to thank you all for joining us today.
Thank you for having us today. I'm glad to be here with you.
Right.
Likewise.
Thank you. And you guys drove all the way down from Dayton. So I really feel like that was great, just to make sure that you have some good information. So get your pen and paper out just in case you need to take some notes. So we're going to jump right into this. We ended open enrollment in January.
Correct.
So now we're kind of in that down period, getting ready for open enrollment to start in November.
Open enrollment in November begins November 1 and it ends December 15th. So the time span for this open enrollment period is shorter than the previous periods that we've did enrollment into healthcare. So we will not be going into January 2018. It will run from November the 1st through December 15th, 2017. So people should write that down.
And that is really a short period, or shorter than we've seen.
Yes.
I know the first year we were working together then, what was it, 6 months? It went from
like October into almost
April.
April, yes.
You know, but that was the rollout, and there were so many issues with the system and all of the glitches.
And plus, there was a lot of people enrolling, so those deadlines at midnight, you still had people on the system. And they thought it was wise to extend that period for people. And that was the correct decision to do at that time.
Now, another thing, here's what's interesting. It's a shorter period, but there are less navigators. Or are there less navigators? Because I know a lot of the organizations, when we were working, or when I worked with Enroll America, I know some of those organizations are gone.
Yes, they are.
So is there a shortage of navigators to get people enrolled, or?
I wouldn't say there's a shortage of navigators. There are still those individuals in our city that still have the capabilities of enrolling people into healthcare. You still have the clinic in Lincoln Heights where Charles Woods works. And they
Kim
are still
Sullivan?
there. Yes, yes, they are still there. Leslie Calhoun is at Crossroads, which is downtown on Lynn Street, and Vine, she's still enrolling, as well as Angela Robinson with the City of Cincinnati with our health departments. They are still enrolling. So there are still other people in the community that are still enrolling. And I hope I didn't miss anybody.
Right. Just to build off that, Marjorie, I mean, you're absolutely correct. There's still a lot of folks in the city themselves that are working on this, and there might not be as many navigators or individuals or organizations working on it, and there's definitely a lot less people working on outreach and education. But part of what makes us so helpful to the cause as navigators is that we make ourselves incredibly accessible to the community. We are not just telling you, oh, you need to be here at this place, this time, at our office. For anyone that's watching that needs assistance, we make ourselves extremely available to meet in public around your schedule, day or night. We can even accommodate people on weekends. We understand how working people function in their day-to-day lives, and we want to make sure we accommodate them because, we can't say just how much, this is important to their overall health. So we try to, pull out all the stops and make ourselves very available. So even if the number of people doing what we do has declined, I would say the quality and availability overall of assistance certainly has not.
And there's still UCAN, they're still available. Brenda is still doing enrollment. And so there are a variety of organizations, health departments, and plenty of folks out here that could be of assistance.
Okay. So is there anything new or different in the enrollment process that would not have been, say, the last 3 enrollment periods that's coming up?
I would only think that the change in the open enrollment period for the marketplace is the most drastic change people will see. I think there's a change with the special enrollment period with regards to validation of the information for you to enroll under that component.
Right, and I think you mentioned that to me the other day, that before it was just a matter of saying, hey, I fall into one of these special open enrollment categories, and it was almost taken at your word. But now you have to have concrete proof that you have fallen in. And what, let's say for instance, I know what it would be if I just moved into the city, but what is it? Documentation? Do I need certified documents, or how do I
The
fall in there?
marketplace will get back with you either through email or through the mail, and it will tell you that you need to respond back to the directive. If you say you've changed jobs, you're making less money, you're new to the city, you've had a child, you've gotten married, those factors are what are considered in the special enrollment period, and they'll just ask you to show that documentation. Make a copy of it. You can scan it, you can email it, you can mail it, you can fax it to
So I can't
the
send a
marketplace.
picture of me holding baby Jackie?
No,
Not yet.
which would be cute, but
I'm sure they'd like it. But
that's
wouldn't
not
work.
real documentation.
they'd be like, that's great, now let's see this.
Let's see the paperwork.
Right.
Was that in place this past open enrollment period, or is this just what's going to be in place for November?
It came about after the end of the open enrollment period. The marketplace told us that there was going to be some criteria for folks who say they fall under the special enrollment period, that's all.
Right, and during the open enrollment, because you're already allowed to go in, there's not a whole lot they typically verify. The reason they ask for it during the special enrollment is to make sure that you actually have the permission to go in while the marketplace is closed. So pretty much anything they're going to ask for, it isn't so much that they're trying to verify, who you are or where you live, things like that. It's going to be much more of, do you meet one of these categories and can you prove it to us? So, to kind of contrast that with open enrollment, they ask for a lot less in those scenarios, but an example they might ask for then is income, because as we'll get into later, I'm sure maybe a little bit, it's all income based, and that's what they use to calculate your tax credit or the subsidy that the government will use to help you afford your plan per month, your monthly premiums. They will typically only ask for certain things if you submit information that does not match up with the federal record. So if if your last IRS tax return says that you made X amount of dollars, and the amount you submit for your new open enrollment information is vastly different, they might ask about that and ask for some kind of wage statement or something to prove that you're getting the tax credit that you're actually entitled to. But mainly, you're much more worried about your documentation and things during the special enrollment than the open enrollment.
Okay, well, since you mentioned it, so let's just jump into that. Let's get into the financial part of it. I'm not going to act like I remember all the guidelines, and I try. And I have the old sheets because I was looking at the old sheets the other day, and I said, okay, I have no idea if these guidelines are actually it. So let's start at Medicaid. I talk about Medicaid, or I mention it every show, and I'm using that figure. So am I on point, or how far off am I? I'm setting
believe-
myself up to look really bad if I'm really far off.
No, you're not. But that guideline is $16,242 is what the yearly income is for Medicaid for a person who is single in the state of Ohio. Remember, we're talking about Ohio here.
Right. Only in Ohio.
Yes, because I'm pretty sure people in Kentucky or Indiana or West Virginia might say, we can do this too. But no, that is the Ohio guideline.
Right, and just one thing to add on to that, that number is accurate, but one thing that Ohio does when they're looking at your Medicaid is they're going to always look at your monthly income, which, for some folks that can be really confusing, because if you have, fluctuating hours, if you're the kind of person that earns some of your money based off commission, you might be eligible one month and not eligible the other month, at least on paper, which can, make it difficult. But the important thing is you always got to apply at least, because you don't know until you get a firm answer. And a lot of times, you can submit those kind of documents that are going to help your local Medicaid agency determine that kind of thing.
And that's done through Jobs and Family Services in each of the counties in our state.
So let's say I'm in sales, and so as you mentioned, my income is going to fluctuate.
Right.
Does that mean that the 2 months I'm under that guideline and I'm good, and then the third month I make over the guideline, go back to the fourth month, I'm under again? Does that mean that somewhere I'm going to have lapse, I'm going to be kicked off, then I have to go back through the whole process of applying and waiting that 30, 40 days or whatever it is to get health care again?
The good rule of thumb is, so that's where the annual figure you guys cited comes up. So, say you are over for those couple months, and so you're going to be in the federal marketplace at healthcare.gov as opposed to Medicaid. If you go under one of those months, but you're still over the Medicaid guideline for the whole year, you're still going to be on marketplace. Now, it's a little different if more often than not you're under the guideline. That's a little different scenario. But if you're generally over and then there's just a month here or there, that's not going to affect it, because the federal government is going to look at your annual, whereas the state looks at your
And that's what I'm
monthly.
talking about. I'm talking about as far as Medicaid.
Right.
So if I'm that single cat guy and I'm making $16,242,
42.
but I'll do sales or whatever it is. So the next 2 months, I make 16,250 or whatever over for 2 months. Then I come back after the two, and I'm back to where I was below the guideline. Is there a point where I'll get a letter saying, hey, for 2 months you were over the amount for Medicaid and you needed to go to the marketplace, and so your Medicaid has been cut off?
We've never experienced any of that, but I would think if there is a question, the representatives from Jobs and Family Services should be sending you something out that asks you to respond back to it in a time frame so that you can show them, yep, I was over this month, but however, I'm under all these other months. And so I fall right in line to the yearly equation of being eligible for Medicaid.
Right. That's something that's best addressed. Like I said, you have your provisions for if you're over for the annual. If you're talking about something like you just described, that's going to be something your caseworker at the county level is going to take into account when they're working with you. In fact, there's even something on the Medicaid application directly that says, is your month-to-month income not steady? So it is something that Jobs and Family Services does take into account. But I don't want to, kind of commit to a blanket statement saying, oh,
Oh,
everyone will
right.
be good in this case or
Right,
not.
right. We can't do
That is something specifically I think Jobs and Family Services is going to better address. But we definitely know, based on that income threshold alone, generally which you're going to be eligible for or not. And also, just one thing we didn't talk about a little earlier, that threshold, like you said, that's for a single person only.
Right.
It goes up a few $1,000s for
Oh,
each
yeah, I wanted to
additional
get to
member.
that, too.
Yeah,
Okay.
absolutely.
I was going to get.
Oh, I know you were.
I'm just talking about one person
I
at
know you
first, but I
I know
think
you
one of the
were.
things that I found really fascinating or interesting when I did work in that field was a family of 4. Now I don't know what I don't know what it is now. I think it was like 44,000 or somewhere around there a year was actually eligible for Medicaid. And what do you know? Do you know that figure off the top of your head? And if not, I know it was somewhere around 45,000. I think if you were making that collectively in your household, you were a family of 4. That still made you eligible for Medicaid. And I know that a lot of families didn't know that, and some were actually trying to go into, calling up individual insurance companies and purchasing health care or trying to purchase health care at an astronomical price. So I was just wondering.
So the best thing to do if you're looking at that, it would be to contact the folks that actually do the work. We would look at your situation, look at your income, put it into the system. And the system will guide us. If we're going into the marketplace and we think you're marketplace eligible, and it'll kick it back out to us, and it'll tell us we're sending that to your local Jobs and Family Services because you are eligible for Medicaid.
Okay. And so then what are the managed care companies that would handle, I guess, Medicaid?
There are 5 companies, and help me if I get wrong here. Buckeye, Paramount, CareSource. I'm missing 2.
The other 2 are United Healthcare,
Right.
Community Plan. I only say that because most people are more familiar with them not in Medicaid, and then Molina Healthcare
Molina.
as well.
How could I forget Molina?
Yeah.
So there are 5 managed care companies.
Yes.
And you have to choose one.
You will choose one after Jobs and Family sends you a letter with regards to Medicaid, and it'll say you have certain amount of days. I don't want to give you the days. Certain amount of days to respond back to this and select a provider. If you don't do that, we will select one for you. If they select one for you, you cannot go back and say, hey, I don't want this, I want this. You'll have to wait till your open enrollment period to
But that
respond.
we selecting is we in terms of job and family,
Yes.
not the navigator.
Right.
Right,
We
yeah.
select nothing
Right.
for anybody. We do not sway anybody
Yeah.
into a particular plan.
Yeah, we're not
we
allowed
just,
to, period.
We're just provide information to the consumers so they can make better choices about their healthcare needs.
Okay. So if I've never sat down with a navigator, what should I expect? Because for some people, even though now is this the 4th enrollment period? We're going into the
Yes.
4th enrollment period. There are still some people, believe it or not, that have not actually sat down. I'm talking about marketplace now. I should have said shifting from Medicaid to marketplace. We'll come back to Medicaid.
All right.
But shifting to the marketplace, there are still some people who have not sat down and went shopping, have gone shopping for health care. So I've never sat down with a navigator. What should I expect? Or what do I need? Let's start with that. What do I need first?
I think you need to provide us with your information. A lot of people will bring their IDs, their social security card, and if they're employed, they will bring their pay stubs. If they have been laid off from a job, they will bring that information so that we get to see that documentation as we begin the process. What we do is we tell people we're governed by HIPAA, that we do not share, sell, or do anything with your information other than assist you with getting enrolled. And then we begin the process of putting that documentation into the system, and it will ask us some questions regarding them to validate that they are who they are.
Right, and just kind of reiterate off that, the very first thing they can expect is that, we try to provide the most, comfortable, private, secure environment that we can because we know how serious this is for folks. These are people that are entrusting us with, knowledge of their financials, knowledge of their families, knowledge of their health situations. And not only are we governed by HIPAA and we cannot share any of that information, we have to keep it all completely confidential, but we want to make them comfortable in doing it because we know it's a big deal. And so that's the very first thing you can expect is a non-judgmental, safe, confidential environment in which, to even go back to what we talked about earlier, our job as navigators fundamentally is help you find the most affordable thing that meets you and your family's medical needs. That is the Navigator program in a nutshell. And on top, what Marjorie said, you're going to want to make sure you have those documents to help verify the information it's going to ask. We're not legally required to see them, but it certainly helps expedite the process. And also, that we talked about them shortening the time period. The great thing about it is when you have a navigator sitting down and working with you, you can get this done in less than 2 hours if, everything is in order. So it's not a huge time commitment to sit down. In a lot of cases, sitting down with the navigator is going to make this go so much quicker and smoother than to try and figure it out on your own.
So I don't have to show you certain documents. Would that be like tax returns and things of that nature? But does that slow down my process if you're not able to? Because are you entering that information into the system?
We do enter
So if I don't show
income.
it to you, then
We can look at it. Most people know it based upon what they tell us. And there's some legalities of it. The system will have questions that we need to let them know that they are responsible for the information that they give to us. If that's incorrect, they could lose their subsidy, or at tax time, that could be added onto their taxes.
okay.
Right. So it's like Marjorie just said, there's nothing that we legally have to see. If they bring it, it expedites the process. But as she said, most folks just know it. We don't need to see a social security card, but if you know your number, we're all set. If you know how much you're making an hour and you know your hours, we don't need to see a pay stub. Now, the difference is Marketplace may request a few of those things like we talked about earlier, but as far as your appointment, we don't want to encourage anyone not to show up because, they think, oh, I don't have my social on me right now, it's at the bank in a safe deposit box, or I don't have my tax return yet, or I can't access it real easily. As long as you know that information and you can enter it reliably, or we can enter it reliably for you, you're good to go.
So once I sit down, with you, I have my social security card, I have my driver's license. I stopped on my way home, but I didn't go there first. So I don't have my tax papers and all that. Then I can go back later and enter that information?
You can go back after an application is completed. We provide you with the numbers to the Marketplace. We also provide you with information to Jobs and Family Services. So if there's a change, we encourage you to go back and let them know that, and they can make that documentation to the application process.
Okay, so you're not lost out because you didn't have it on you. So now here's a question. Some people in my household are not documented, but I am. I mean, I'm here. I'm a citizen, or I'm here legally. But I have people in my household that are not documented. And this is something that I know we ran into when I was at Enroll, more so up north in Columbus and Cleveland, Youngstown area, more so than in Cincinnati. But that is something for some people. They won't enroll, and they're eligible to enroll because they feel if they sit down with a navigator, you're going to, and we're not going to make this a political conversation because we can't. But I just want to say that so that people understand, when you sit down with a navigator, they are not federal agents. That's not their job to ask you for cards and all this information. They'll submit your information. And as Ryan said, if it doesn't pan out, or if there's something or a question that the government may have or the state may have, then they'll reach out to you and say, hey, we need clarification, or we need this information.
Correct.
And just wanted to get that out so that people understand, listen, it is a safe, it's an easy process. And once you go through it, it's going to take a little bit of time, right? I think Medicaid is about 20 minutes.
It all depends. The system is...
Right, we've done enough that we could do it in
probably 20 minutes. But if the system goes down, then we always have the paper. and if the system goes down on the marketplace, we always can call. So there are always other options available, and we work there with you because sometimes people are intimidated by doing it, and knowing that you have somebody that's comfortable with talking to folks that do this, it makes that transition to completing the process even easier.
Right, and that's part of our mission, like we talked about earlier, be culturally sensitive and be, just very accommodating, is that there's actually a provision in what we do that says we cannot use any of the information you share with us for any law enforcement purposes. Obviously, we're not law enforcement ourselves, of course, but we can't even share that or use that, and they are not allowed to use that either. It's not like Department of Homeland Security can go into your healthcare application and pull that information out. That is not something that's legally done.
So it is strictly, when you're a navigator, your job strictly, completely is to try to get people enrolled in healthcare, whether it's Marketplace or Medicaid. If it's Marketplace, you do your best to try to get them the best.
Yes.
But you can't say this one is better.
Right.
But you do your best to try to help them.
What we do, Jackie, is what we ask them, what are your healthcare needs? What is your family healthcare needs? That way you get them to think about what they need and need to look for in their lives, in their household, what they have experienced or not experienced, or things that they need to do to make sure that they do the most preventative thing for themselves and their families.
Right, and what's better for one person may not be better for the other. You log on to healthcare.gov, you're going to see the bronze plan, the silver plan, and the gold plan, and most people are
And the platinum plan.
And the platinum, or you're going to think to yourself, oh, well, the gold by definition is going to be better, right? Not necessarily. I mean, if we've helped folks, if you're a younger person that doesn't have a lot of healthcare needs, you just want to make sure, hey, I'm covered to make sure I can go get my annual physical and make sure I stay healthy. Or if I, God forbid, have to go to the emergency room for some reason, I'm not going to enter bankruptcy. A bronze plan can be the best plan for you. If you're someone that is managing diabetes, if you're someone that is, unfortunately fighting cancer, a gold plan is going to most likely be the best for you because it's going to keep your, out-of-pocket costs low. So those are the kinds of things, like Marjorie said, that we consider is, share with us your health needs, share with us your financial needs, Those are going to be the kind of things that factor into when we help steer you towards what might be the best plan, but it's ultimately always up to the consumer.
So navigators are almost like not a financial planner, but you're almost like a financial planner, I guess, in a sense, because
Financial health plan?
Financial health planner. Financial health planner.
Yeah,
I mean, because you're taking a lot of, you have to get a lot of information
Yes.
from people. It's not just, hey, tell me your name, your number, here you go, take this and go. Because isn't there a plan? What is it, catastrophic? Is that still?
Not one we've seen in Ohio this past open enrollment. There definitely was in the past.
Right, I knew there was one in the past, so that one.
That may have been when we first started, and plans have changed and improved. And in Ohio, we only saw, I believe, a 1% to 4% increase in the marketplace. Sometimes people say, oh, it increased by 40%. Not in the state of Ohio, it didn't.
Right, and part of the reason that is Ohio, one of the benefits for anyone around here that's looking into it is Ohio has some of the greatest number of insurers still on the marketplace, So we've all heard in the news about some of the places they've only got one left or they've only got two left. And you can get away with jacking up your rates when there's not much competition, but Ohio is seeing a lot of robust competition. It's seeing, like Marjorie said, very low increases in the rates, and 1% to 4%, that's great in terms of health insurance. I mean, even before ACA, you would see 15, 20% like clockwork every year. So in a couple places, don't quote me on this, I think the Cleveland market actually saw a couple of their benchmark plans decrease in price during this last open enrollment. So, and with the federal subsidy you can get, a lot of folks are shocked when they see how actually affordable it can be when you factor in their tax credit, rather than the opposite. Most people think, oh, I'm going to go in here, it's going to be way worse than I ever could have imagined. A lot of times people leave, wow, I didn't see that coming at all. That was great.
What we've seen from people is, in my experience, and Ryan can speak about his experience with enrollments, the gratitude of the people that we assist.
And so thank you very much for watching Your Faith and Health Community. Again, I'm Pastor Jackie Jackson, your host. I want to say thanks to our producer, Anita Alexander. And remember, stay faithful and stay healthy.